Conducting system of heart. The conducting system consists of specialized heart muscle cell situated within the myocardium. The electrical conduction system of heart transmits signal generated easily by the sinoatrial node to cause contraction of the heart muscle. The signal generated in the sinoatrial node travels through the right atrium to the atrioventricular node along the bundle of his through the bundle branches to cause contraction of the heart muscle. This signal stimulates contraction first of the right and left atrium, then the right and left ventricles. This process allows blood to be pumped throughout the body. This is the diagram of the conducting system of heart. This is SA node, AB node, left and right bundle of branch, and these are the Purkinje fiber. Artery supply of heart. Another important question for written exam. The heart is supplied by two coronary arteries, right and left coronary artery. Right coronary artery arises from the anterior aortic sinus of the ascending aorta. At first, the artery passes forwards and to the right between the pulmonary trunk and the right auricle, then run downwards in the right anterior coronary sulcus to the junction of the right and inferior border of the heart. It winds round the inferior border of heart, gives marginal branch, then passes upwards and to the left along the posterior part of coronary sulcus, reaches the crux of the heart. Then it reaches the posterior interventricular groove and gives posterior interventricular branch of the right coronary artery. Left coronary artery arises from the left posterior aortic sinus of the ascending aorta. The artery runs forwards and to the left pulmonary trunk and left auricle, then runs downwards, reaches the atrioventricular groove and gives anterior interventricular branch, then runs to the left anterior coronary sulcus, then it winds round the left border of the heart and gives circumflex branch. It terminates by anastomosing with the right coronary artery. This is the diagram of the course of left coronary artery. This is the left coronary artery. Here it gives the circumflex branch and anterior interventricular groove. Here it gives the anterior interventricular branch of left coronary artery. And this is the right coronary artery. It arises from the anterior aortic sinus. Then it runs downwards, and on the left border it gives the on the inferior border it gives the marginal branch. On posterior surface in the posterior interventricular groove it gives largest branch, posterior interventricular branch of the right coronary artery. Nerve supply of heart. Heart is supplied by autonomic nervous system, sympathetic and parasympathetic. Sympathetic from thoracic to 5 segments of the spinal cord, which causes increase the cardiac output, increase the heart rate, increase blood pressure, and it dilate the coronary vessels. Parasympathetic supplied by the vagus nerve, which causes decreased cardiac output, decreased heart rate, decreased blood pressure, and constrict the coronary vessels. Some clinical question come from the heart, that is tetralogy of Fallot's. It is a congenital anomaly of heart, consists of 4 components: pulmonary stenosis, overriding aorta, ventricular septal defect, right ventricular hypertrophy. This is all about the thorax.